Okay, ready? Okay, hello everybody. We had a little technical difficulties, but we got it fixed. So follow me as we go along. I'm going to be talking about the heart attack, the silent killer. We call it the silent killer cardiovascular disorders. You notice I didn't say disease, I said disorders, because a lot of times you can have a disorder before you get a disease. So disease is the ultimate that you don't want to get. Okay. So now we're going to be talking about all that, and so we're about talking about various things as far as the makeup of the heart, all the structures that feed the heart, also how they accompanying structures like the liver, the kidneys, the different gastric system like stomach and pancreas can affect the heart, also the brain. And so if you don't know the connections and only deal with the heart, you're missing the boat there, because there are a lot of contributing factors that can create the cardiovascular disorders. So how it works is you usually get inflammation, and you probably have something of discomfort, and then a lot of times you can't pick it up on an EKG, you can't pick it up on a regular test that they do, echo test and all that, and so you won't be able to find it. But yet you suffer some of the symptoms, and that could be in the early stages, and it could be what we call inflammation. Then it goes into a disorder or dysfunction. Rather, the body is not functioning properly for the organs to feed the heart with blood and exiting the heart through the vessels. And then all of a sudden you get a disorder, and then now they start picking up glimpses of it. Your blood pressure high, or your some problems with that, and then you go into a disease. Now the doctors can see it with all the testing equipment. So we're going to lead you up to the basics so you can understand all the parts of the heart, the valves, the tricuspid valves, and all these, so you're going to understand what it is. Then we're going to go ahead and tell you what the contributing factors are in the physical level. I'm talking about that. And we will show you that in the next few slides. And then we'll be able to bring you into early signs that you can see when you look at a person's face, the tongue, pulse, meridian testings, different things, the skin. And so all these things you can see, so precursors to a particular heart problem. And then from that point on, we'll tell you all the tests and all the surgery you can do before surgery, after surgery, what you can do to help before the surgery, prepare the surgeons for the operations if you're going to go through that, and then after, how you maintain what they've done in terms surgically and scar tissues and all the adhesions and all these different things. And then from that point on, we'll recommend some kind of supplements for you. And finally, on the final fourth webinar, we're going to be teaching you how to take care of it through the quantum, how you be able to tone in your body cells, and how you do it with the quantum and all the protocols that go with it. So next slide. And so this is one of my slides I gave several years ago at the health food stores. I used to go to health food stores. I was invited to that there, and I mean, used to lectures with a good amount of people and different seminars. So I took parts of this, and you're going to see it called the silent killer. And why I call it silent killer, because you can be a walking time bomb. We had a person that came from Mexico, and all the signs show that he's a walking time bomb, as we did some early testings on him. And he said he feels okay, but you know, he coughs a little bit, he wheezes a little bit, and so basically he's overweight and all that. And so those are called walking time bombs, because I give you an example. We had a person who was retired, and he ran 5 Honolulu marathons, and 6th one, he says you better go to the doctor, have a full checkup. He went to the doctor 1 month before the 6th marathon, and everything was saying perfect. The guy was about 73 years old, and so he was warming up in the afternoon. He collapsed, died from a massive heart attack. So you're going to see some of that, the silent killers. And so we're going to show you all these silent killers that are going to contribute to your possible heart attack. So the crisis, the signs of heart attacks, we're going to give you an overview right now. And some of the stresses can cause heart diseases. And in our economy right now, a lot of people are stressed out, loss of jobs, overwork, worried about the economy, supporting their families, so forth. A lot of additional stresses they never had for the last maybe 10 years ago when things were sort of, the economy was robust. But now that's additional to that. So a lot of stresses are creating a problem. And what does a full-blown heart attack look like? You're going to see that. We're going to show you what that looks like. And some of the remnants that you might have that you accumulated over the years, they don't come up rapidly in terms of, like, say, all of a sudden you get one and you wonder how come that happened, because you didn't have any kind of sensations or feelings, or he give you any clue. Okay. And all of a sudden it comes up like that, and you wonder how come you got that, because you thought you were pretty healthy, you exercise, you thought you mentally was more stable, and emotionally you thought you had it under control, and yet you have all these different signs that would lead you to a massive heart attack. Cardiac signs, heart scans, and you know about the heart scan. There's many different heart scans out there, and we'll show you how the quantum infinity probe can help you with that. In terms of that, nothing's absolute. Even there, the test that they use outside and traditionally, nothing is absolute. Okay, there's still some, accuracy problems. Stressors assessment for causes. We talk about that. Holistic integrations. How we be able to use a very strict protocol. Step 1, 2, and 3. So then it makes it easy for you to follow. And some of the people right now do have high blood. People have high blood pressure. How do we reduce that? We had a doctor just came in. His high blood pressure was 165. It used to be 195. He doesn't feel too good in the last 3 months. And so we ran him through the test and balanced them out. He's very, very good at following orders and doing what we told him to do. And in 3 weeks, he dropped from 165 to 140. So that's pretty good testimony that something is working that we've done to help him. And so evidence-based medicine, we're trying to keep that as an evidence-based medicine rather than just only testimonies and my philosophy. Okay, you can take some notes there. That's what we had in a workbook and people taking notes. Okay, here, 700,000 Americans have a first heart attack per year. And once you get it, you're kind of doomed, because they said that you're going to have these mini strokes or these many things that come on and can lead to a massive heart attack or a bad heart attack. And so, so everybody looks at cholesterol, LDL, HDL, triglycerides. Is that the only thing we're going to worry about? No. I mean, there's things that create the problem of we want to find what the causes is. We want to find out what creates this problem in the heart and the blood vessels. It's primarily not into the heart by itself, because the heart is just a pump, like a muscle. But the ones we worried about is the vessels, all that, because even though it cleans in the heart, it goes and pushes the blood out through the blood vessels. Blood vessels can be stiff, or blood vessels can be have fibrosis in there, causes atherosclerosis or arteriosclerosis, which is like a clogging up the blood vessels internally, and that's called the endothelium, which is inside lining of the blood vessels. So what you want to do is you want to see all these things that can contribute to this heart attack, okay? So you say right here, I just read just the top line. It says, according to the recent estimate, about 1 in 3 U.S. adults has high blood pressure, but because there are no symptoms, you heard that, no symptoms, nearly 1/3 of these people don't know they have it. In fact, many people have high blood pressure for years without even knowing it. Uncontrolled high blood pressure can lead to stroke, heart attacks, heart failures, kidney failures. This is why high blood pressure is often called the silent killer. The only way to tell if you have high blood pressure is to have your blood pressure checked. How many people really have those monitors that can check your blood pressure? No, I don't think that too many people, but And even though they tested, when you test the blood pressure in the morning, it's different from the one in the afternoon, and one and during the evening, and after meals you test it, and so they can fluctuate back and forth, which is the right way. And so we've learned from our studies that you have to usually take it first thing in the morning when you get up, take it and you take it for 5 days. You average it out divided by 5 total. Average all the blood pressures every day, add it all up, divide it by, say, if you did 5 days, which is recommended, you divide it by 5, and that's your means average blood pressure. And so all you have to do is take a little sugar or your meals, salt, and everything, and you see the blood pressure can rise. But then you should drop back to normal if that happens within, say, 45 minutes, an hour, or maybe hour and a half, and then you check it again, and you should stabilize. And that's usually the blood pressure you want, okay, if it's not past 130, 110 over 130, okay? Okay, and there is more bad news. On top of that, you see the blood pressure, another 59 million Americans have pre-hypertension. Not in the danger zone yet, has definitely on the borderline. So it's a lot of people per year. And this statistics is at least 4 years old. Okay, I'm not sure that it's probably higher now. Because why? Because it's the #1 killer in America, and diabetes was #7 ranked. But guess what? It's the diabetes section in terms of the risk factor has gone up from 7th place to about 5th. And then the third one is all of a sudden out of nowhere is the response to drugs. All of a sudden that became #3 in a hit parade of death, okay? And so we've got to be very careful about that. So the drugs are contributing to the factor, some of that, and we've had patients that 10, 20, 30 years taking the same remedy, the drugs, and they're getting nowhere. Their blood pressure's still high, they're still feeling terrible, and they don't feel too good to begin with. And so why is that the case? So we're going to be talking about that more and give you some clues of what to do. And so the silent killer lies in wait. High blood pressure doesn't usually have symptoms. Over 1/3 of his victims don't even know that the killer that's lurking inside of them, it's quietly damages your hearts and arteries. So what happens is, like triglycerides, for instance, it's like crystals, broken glass. And as it goes through your blood vessels, they're called endothelium. And the endothelium is the lining of the inside lining of your blood vessels. And so when the triglycerides get in there, it's like broken glass going through that, and it's cutting up some of the inside lining of the endothelium. And once the brush goes through, it doesn't have a smooth flow through it. It's going through like cuts and bruises and bumps and like caves. They're like going into a cave, and it has all these like pockets and things like that. So if the water goes through, it's going to hit all these pockets first and stir around and cause all kind of problems. So your blood pressure becomes irregular. And so what happens is that's what triglycerides do. But then again, you got fat. And of course the fat, what's happened to the fat? Where does the fat come from? The fat comes from the liver, right? Because the liver can't break it down and to use it for energy, long-term energy. So the lipid, so they call it lipid resistance. And so then what happens, instead of the fat being utilized properly for long-term energy, it builds up storage of fat in your stomach. And what happens is that those things go right into the bloodstream, into the inferior vena cava, goes right into the heart. And then the heart starts mixing it up and goes into the different chambers, and then it goes out to the aorta, out to the blood vessels, and to the organs and muscles and everything else. And so therefore, we have to clear that out. And so one of the keys is looking for fibrosis, which is called atherosclerosis. And you say, well, older people usually get that. Well, hey, wait a minute now. Why is it older people have that? Because it's all built up, and pretty soon all these in the endothelium, they start to clog up. All these fats will join up together, they bunched up together, and then they start getting, so the body's reaction is to protection. And so then they start to get these fibrous tissue becomes like hard, And so the blood vessels can't expand when you need it to go. Get it when you're excited and more blood to rush through. You can't expand those blood vessels, and it's constricted. Blood pressure shoots up. Okay, so what happens is it takes a little more pressure to push it through the blood vessel, the volume of blood through the blood vessels. What it check with blood volumes. Okay, so all these little things like that. I'm only giving you sort of a synopsis or a summary because we can go into that really in detail, and you see it with our webinar coming up. Okay, so again, so once the blood gets hard, get a harder time to circulate in your body, guess what? You're going to feel it. Now you're going to feel pressure in your heart. You're going to feel, you're worried about that. You go to the doctor, and sometimes, like I said, you can get a false reading because what? You might have had heartburn. You got a digestive problem. And then the descending colon, you look on the left side of your body, and it snakes around. It comes like a little curve when it goes, called the transverse colon, goes straight across by your belly button, and then it kind of loops up and then goes down. It's called the descending colon or the sigmoid flexure, and then it gets bunched up, and you feel pressure on your left side by the rib cage, and you feel, oh gosh, I got a heart attack or things, and it's actually you got digestion problems or irritable bowel syndrome or something. And then also maybe you got a muscle strain because of your pectoralis major and minor in the front, and then that can cause you a false sense of heart attacks. So you got to be really good in differentiating that. And then of course you can't get enough blood to your brain because the blood is not being circulated with oxygen, and because it doesn't go to the lungs, the pulmonary artery and veins, and so what? You're not nourishing the blood with oxygen, because when the blood comes in from the spleen or the bone marrow into the heart, guess what happens? I mean, in the lungs, sorry, through the alveolar sacs, guess what happens? That's erythrocytes, which is, it doesn't have any iron, and I mean, they have, doesn't have anything oxygen, but the iron's in there, the hemoglobin. And so what happens is you can't clean the oxygen molecules in there, so you're not getting enough oxygen clinging into the red blood cells, and by the time it goes into the brain, you get oxygen deprivation, things like that. So then you start feeling tired, you start feeling mentally stressed, you can't think correctly, you get a lot of different depression and all, chronically fatigued, basically what it is. Okay, and so there's a lot of things going on in this. It's not just looking at the heart itself. There's so many different things that could create a problem with the heart. Okay, and then so there's a signs here. If you can read what I have a whole list of signs there. Okay, angina, chest pain that moves to the chest, and usually your left arm, you feel the pain going down your left arm, and then you go to the physician and give you nitrates, and what that helps because it opens up the blood vessels and get more blood coming in. But guess what? How many times you got to take this? I mean, well, let's find the source so you don't have to take the nitrates and everything. Okay, you get blood vessels blocking the cholesterols or blood clots, and does not allow enough oxygen-rich blood to the heart muscles. Remember, the muscle is made of a whole bunch of cells, and they need some oxygen, okay, to function well. You have burning pressure in the chest, you know, some of that, and these people wheezing, especially people who smoke a lot or around smoke, and they sometimes have a problem, even though they're not smokers. Two of my friends, one was a wife, they passed away because they didn't smoke, but they were in a smoke environment, and they passed away with cancer of the lungs. Okay, and nausea, being sick in the stomach, vomiting. Why? Because it goes to the brain, and the brain sends signals from the brain, and a lot of times it's serotonin, and the serotonin can send encapherin cells, and then they get activated, and the stomach don't feel too good. And plus, you get high acid in there, and because the stomach is not producing enough hydrochloric acid in the stomach while you eat, and it's producing it in between meals. And then you get upset stomach, gastritis, you get the heartburn. And also what happens is that when you have that, what do? You take an antacid, then it makes it worse, even though you feel more comfortable at that particular time, but you feel worse. And then it kicks into the adrenal gland, and the adrenal gland, because you're stressed, That's one that produces, stimulates the gastrin, which produces hydrochloric acid in the stomach. So when you're stressed out, you get the adrenal glands occurring problems. With the stress, short-term stress, long-term stress is the cortisol. And so then what stimulates that? Okay, that is stimulated by the brain, ACH, okay, acetylcholine. And what stimulates with the kidney? We're talking about the kidney now. Well, what the kidney got to do with this? Well, the kidney basically controls how much urine is filtered into blood. And what happens is also the renin is produced by the liver. And so what happens is that when you stimulate that, guess what happens? It's not the liver, it's by the adrenal gland, and the adrenal gland. And so that is regulated by the stress of the adrenal gland, the kidneys start kicking up, and that can cause the blood pressure problems too. With more fluid, the control fluid going to your blood vessels. So you sometimes heavy sitting on your chest, that can cause it because you can't breathe properly and it's compressed. A tight band around the chest, I told you about that, could be a muscle tightness of pectoralis major or minor, can cause that problem in the chest. Okay, anxiety and extreme weakness, that can be from mental stress, especially if your brain doesn't have enough oxygen feeding the cells in the brain. Also, and palpitation, feeling the heart is beating too fast or irregular beat heart. So the sinus node in there, it's supposed to be regulating your heartbeat as well as the respiratory rate, and then also the medulla oblongata can in the back of the brain. That can regulate that. So you see, if you know all these different parts and know all these different signals, you can more or less can do some testing by palpating, by doing some tests on the different equipment, biofeedback equipment, the quantum infinity. You have that, but just remember, that's an indicator. It's not absolute. Nothing's absolute, but it gives you an indicator to further go and research the problem. So cardiac arrest, okay, it strikes immediately and without warning. Sudden loss of responsiveness, to no response to tapping on the shoulder, no normal breathing. Victim does not have normal breath. When you tilt the head up and the cheek for at least 5 seconds. See? So women differ from men, may report symptoms prior to heart attacks, although symptoms not typical of heart symptoms. Upper back or shoulder pain, that's very common, especially in teachers where they're down, they're always writing, looking at the students' papers and bending down, clerks, people who do computers, all these people that have that. And those stresses on the muscles over there can create problems on the chest area in the back and cause contractions, okay? You can get upper jaw pain or pain spreading to the jaw. And that's very common. You got to remember now the blood vessels also go to the facial muscles, and that can be restricted because if you have say a TMJ or the muscles called myofascial pain in the face, okay, neuromuscular pain, constrictions, you actually are causing the muscles to contract, and when they tighten, the blood vessels underneath, they start to get constricted, and then they have to get more blood going in there to feed oxygen, and then of course you can get some pain, problems with the blood vessels, and migraine headaches, you can get that too. That's all again in the head area, okay? Sleep disturbance, you can't sleep, especially a lot of times you get restless leg syndrome. You can get problems with the blood filling up and engorging in the lower leg and the varicose veins. And so all these different things is because the circulation is not going good. And so why? See, why is a blood vessel versus a artery versus a vein? So you get to know that because of the anatomy of the blood vessels itself and how much pressure you got to push the blood through that narrow space in the blood vessels. Okay, shortness of breath, again, respiratory, you can't get enough blood in oxygen into the cells, into the alveolar sacs in the lungs, and then you can't get enough oxygen to your blood as it comes out of the aorta into the going into the brain as well as the rest of the body. Indigestion again, because you don't have enough the blood is going to the stomach, which is oxygenated. The organs don't work as well. Same thing. Anxiety, same thing with the brain. So you talk about myocardial infarction, you got arteriosclerosis, you got thrombosis, you got all these are different things called dysfunctional. I call it dysfunctional or disorder. It's the dysfunction, the organ doesn't work as well, and then you get into a disorder. And that's the next step, because the next step goes into a disease state. It means you had it for a while, the tissues are really breaking down, and the cells are dying more than the cells replacing it. And then, of course, they go into degeneration. Okay? So these are some of the signs that you see that we all talk about. We all are alerted to that. It's a lot heavy in the literature. But where's the other thing that you can look at somebody's face, you can look at somebody's tongue, you can feel the pulse in there. There's not too much in the literature because it's found in Chinese. Okay? The Chinese 5-element law, you can check that out. And then, so we're going to be showing you some of that in a minute, just a brief things, and show you how to look for those things, okay? Symptoms of the heart attack, shortness of breath, weakness, unusual fatigue. Most of my patients come in, they're usually fatigued, their blood pressure is high, and they don't understand. They get cold sweats, especially when they sleep at night. Why? Because you get also the thyroid involved. The thyroid is involved, so that's a gland. Now you get the organs, kidney, liver, pancreas, high sugar insulin, hypoglycemia, hypotension. All these things are related to these different organs, okay? And that all translates to the heart, okay? Then here's the cardiac signs I told you. I put some of those up there. You can see. You can even look at the fingernails, okay? Look at the fingernails, and you can see short, okay? Short with reddish and cardiovascular red hands. So you can read it. Okay, you get some sort of hemorrhage. You can look at the fingernails, and some people do, the Chinese people, they look at the fingernails, and then they look at the tongue, and you can see the delicate tongue, and you can see right on the tip of the tongue, if it's really red on the tip of the tongue, you know this person's got a really bad vascular problem, okay? And then you can see a little more behind, that's the lung area, respiratory. You can see it can be affecting the lung. And then you look at the left side here, the tip of the tongue, as I showed you right here, you can see a heart disease, okay, right in here, around, see the red area right in the tip of the tongue. And then the tip of the tongue alignment, you can see a tip red. And then you're going to see some over here, the liver on the side, okay, the small intestine and large intestines in the back. In the center right in the back is the respiratory area. So if you look at the tongue and somebody sticks their tongue on, it's red, it's furry, it's got a hairy tongue, and it's yellowish, like it could be like a liver problem on the side. Well, you can say, well, let's check that further. It's not absolute, but it can change. Once you start doing your therapy and it starts to change in a month, 30 days, 40, 45, 50 days, then you know, wow, something's changing. You can see that in the visible signs in your tongue. Oh, how about the ear? Sometimes you see a congested heart attack. Heart problems, not heart attack, congested heart problems. And you can see right on the crease on the edge. This is like a long-term thing. You've had it for when you by your birth, and you have to start to develop a crease in the earlobe here. Okay, that's another condition there. And then you can look at the eyes right here, on the top of the eyes, you see a little red area. And you can see blood vessels popping up by the nose area there, and the cheek is kind of rosy red, things like that. You can see that. And some of the factors contribute to that. I don't have to even tell you this. Look at this. Oh, these stressors are creating some of the cardiac problems, but they're yummy. They call it ono. Ono tastes good. And look how much stuff you got in this sandwich. You got meat, you know, could be processed. You got all kind of bacon, you got bread, you got all these different things. And you say, well, I don't want to give that up. Then, hey, you live with your problem, okay? And same right here. You can look over here and there's fried things right here. It's fried in here in this. Could be a taco, could be a different sandwich. Oh, love this chocolate cake. Oh my goodness. Look at this chocolate over here. All right. And then you say, well, half an hour after you eat, you feel pretty darn good. And then you start getting sleepy. It's like a hypoglycemic symptom. Oh, for those people, they love to smoke. And they smoke, and guess what goes along with the smoke? Hmm? Coffee. All right. And coffee is a stimulus and a diuretic. Okay. And also, you get these soda pop or these drinks. So that adds on to the glucose, and then it makes the heart go haywire, okay, after a while. See? So now you got to try to eliminate that. But the biggest problem here is what? You're dealing with a discipline. How are you going to be able to control all this stuff? That's called an addiction. So you have to go to the brain. And I showed you the CET. We're going to be going over that really strong, more in depth in this fourth part of the series of the cardiovascular. We're going to have to show you and just pound that home so you can use that for pain, for reducing mental stress, for any kinds of different mental, emotional, physical, and spiritual level of stresses, okay? And so therefore, it can also affect your sex in here, because guess what? The brain is connected directly through the meridian cycle, the filament off from the brain, base to the heart, and when the heart affects your genital area or the prostate or the erection, so forth, because of nitrous oxide. Okay, and then here's the daggers. They're very good diagram. I picked this up from Life Extension. They have, if you don't buy Life Extension things in terms of supplements, look at that. At least look at it, because the magazine is phenomenal. Got great research. You have doctors over there can help you if you want to. And so that's not the only place I go. I can't advertise the company, but I said that's one of the resources. I'm just giving you a resource that you can do. And they have beautiful designs and pictures of all different kind of maladies that you might not even realize you have. And this is one. They got 17 daggers to cardiovascular problems. So each one, we have to go through that and say, okay, what do you do with low vitamin K? What do you do with low HDL? What do you do with excess LDL? And so these 7 daggers are the external factors that affect in the heart functions. Okay, but what about the blood vessels? Okay, then we have to go through that. What about other factors that go into it? We have to go through that. Okay, and so here's a holistic integration. So we look at these pre-symptom stresses are neutralized from your mind, emotions, teeth. I'm talking about even teeth creates the problem, and physical body. What I'm talking about teeth, I've been a dentist for 54 years, and a holistic dentist at that. And so what you're looking at, dental materials in your mouth. And everybody knows now the mercury fillings, okay? Amalgam, okay? But hey, what about acrylic, the plastic? You get partial dentures or full dentures. What about that? What about the resin fillings they put in? Do they have some kind of silica in there? Do they have aluminum in there? You know, they get different things that people are some allergic to, all right? What about the partial metal frames you have? And that's made of titanium, and that can cause problems with chrome and different parts that people don't adapt to very well. There's bridges and certain type of gold you have with mixed gold with what's it called now? They have a metal in there that makes it hard, and it's about at least 10%. And so you don't really use all 100% gold. You can, it's too soft. So they use that, you'll come to me. But nevertheless, all these factors got to be considered. But guess what? The teeth is right next to the throat, right now. And what's the throat? It's right next to the heart. So everything goes in there, it goes through your bloodstream, and then goes right into the heart. And then it gets into the cells that are supposed to be nourished with oxygen in the lung and the alveolar sacs, and now you get a mercury molecule attaching to the heart. And then how do you know that? They done some tests, and they find it in the brain. How do you get into the brain, the mercury? It's through the bloodstream, all right? And some could be inhaled, of course, through the olfactory nerve. But hey, this is part of it, what you got to test. not all the rest of them that everybody knows about, triglycerides, HDL, cholesterol, lipid. You got to look at the teeth too, okay? And so we have right now, we have a silent killer, the cardiovascular disorders. I'm going to give you a bunch of information that you need to know. We'll teach you, first of all, the first one will be on March 11th next week. So if we have the announcement, you know, you like it, sign up, okay? We'll be sending you notices about that, the registration, and we start promptly on next week, Tuesday, the series on the silent killer, cardiovascular disorders. What are we going to be talking about? The first thing we got to know is how the heart functions. What are the parts that make up the heart? Okay. Then we move into the vessels. Then we move into the valves. So you're going to get an understanding of that. Then we move into the nerve, how the nerve interacts with the muscles of the heart, and therefore how it regulates the rest of the body. Now, why are you learning all these things for? You say, I just want to get treated. You want to get treated, then go somebody who knows all these things. First of all, you want to get that, so then if something arises, you can start to figure out and start tracking this thing as to where it's coming from, and then approach it from a strategic point of view of what you want to take or what kind of therapy. If somebody suggests to you, what is going to be the best venue for you to go to, and you get the idea where the possible the sources can be and how you be able to strategize to regulate these things that cause the stresses on your heart muscles or the vessels itself. All right, so you got to know how the blood circulation moves. Okay, and it's called the I call it the life cycle. That's the life cycle is going around. Okay, and so the next one we're going to be teaching you is this daggers of heart. What does these daggers mean in a physical level? What kind of supplements they usually use, you know, that can do these? And what is this big thing about nitrogen imbalance? How many people have been telling you about nitrogen imbalances if that regulates the heart flow, heart flow? Targeted vascular disease, risk factors, nutritional therapeutics, and then you're going to talk about some hormones. Hey, the hormones, I talked about that when we went into the brain, how it attaches to the nerve receptors and acts as chemical messengers to the brain. And that was talking about that in pain too, and cardiovascular health. But what testosterone got to do with that? And progesterone, especially in women. Okay, how's that affect your heart? Okay, so then the next thing you're going to be talking about on March 25th is signs and disorders. I talked about a little bit on the left side. You can see a little bit on the right here that I showed you the little diagram just in the previous slide here. We'll go more into that. Where you can really see people and say, oh, let's test your heart. Oh, look, stick your tongue out. Oh, let's do a pulse over here. Okay, and so real quick on how you sit down. Okay, now stand up. Within 4 or 5 minutes, you test the blood pressure. Oh, what happened here? Okay, small little things like that, but you know, it's very helpful for a pre-intervention, pre-detection, early detection of heart disorders. Okay, and then you can talk about how the heart gets the conductivity, why your heart goes irregular, and sometimes they have to go and shock your heart to get the heart rhythm back. But is that permanent? No, it sometimes doesn't work. Not every time, and you get your heart shocked, okay? And then the next one is going to be meridians and sonic therapy. We're going to show you basically where all these points are. And you can say, why do you show me all these acupuncture points? Hey, the acupuncture points developed by Dr. Vo, okay, those are really critical points because those are areas where you can go and get a stimulus, either stimulation or sedation, and send that signal to the brain. And then the brain starts to work on that right signal to help with the heart regulation of the heart. But you still got a clean house, so you might have to get a kidney flush or a liver flush because if it's overloaded, you got to do something to clean it out, okay, and make you feel better, okay. So therefore, and then the final part, we're going to teach you about breathing. Everybody said, well, I breathe. Everybody breathes. Yeah, but do you breathe right? If you're compressed or you're obese or you have poor posture, everything, that can affect your breathing patterns. And if you don't breathe enough, you don't get enough oxygen going into the blood, in the alveolar sacs, in the lung area. So you need to get breathing, and it's very simple. But most people now call it reverse breathing because they're breathing awkward. You breathe totally from the chest. They have to get oxygen reserve from the pelvic diaphragm below the rib cage, and then bring that air up to the body. And see, and so you have also cognitive storage areas. And you look to the right, you can see a small little picture of the whole body. You see the little dots there. I made all these charts, and these charts will show you basically, oh, maybe I can stimulate this area, see what happens. Maybe I feel better. Maybe I can help. And what do you use? Okay, what devices do you use? And then on the lower left, you see right here, you can see the lower left, you can see a picture of all different arrows with how the oxygen disperses from the bottom all the way up to the lungs and the diaphragm and all the way up to the head. See all the blood. So if you understand all these vessels going up and down the body, either veins or arteries or capillaries, lymphatics, you can say, okay, those are the areas of blockage, and I can go ahead and regulate those. So those are the kind of things we're going to be showing you, and then we'll show you the quantum and how you can flow through that and start checking some of the things that you already have the quantum, and you have the Da Vinci. And in the Da Vinci, you have some of those characteristics in there, and you can go check them and see if it helps you. And then you can do some other tests that are more definitive in terms of like a physical test and the breathing, respiratory rate, and all, and see if, yeah, maybe you're shot. Then it leads me to go take another test to maybe traditional, and we show you all pre-traditional, and you test that and you say, yeah, I do have this problem. How do I correct it? How do I make my body feel better? How do I correct chronic fatigue? How do I correct stress, anxieties? Now you got some answers and solutions to that, and it's a whole bunch of them, rather than I only can concentrate on this pill, and this pill is going to do this and this, and it doesn't do it. Well, now what do you do now? You're stuck. And what if you get side reactions from the pill? What do you do now? Okay. And what if you did some destruction of some other cells you didn't anticipate, that the side reactions? No, you're stuck. What are you going to do? So this is really important. That's why I selected this subject matter. Remember, we started off with a system, 7CE, in the first set of webinars. If you don't have that, you should get it. The second one is we went through the brain. Very all important things about the brain. Now, all of you who took the first three, and then the third one was pain. If you took those, you have a foundation if you studied what I just showed you, and I sent you the information. I sent you the slides before we even lectured on, and then the recordings of that after that, so you have an idea where you can make those charts and figure out how the chart's going. And what we're going to do also is we're going to have what we call a group session with all the people who had subscribed to any one of my paid webinars, and we're going to have that in the next few weeks, and we'll make an announcement, and you guys can announce what you need to do, or how, or you don't like this, you can improve that, whatever it is. It's an open forum for you to air your concerns out, and we can address those, or you might want to know more things, and I can address that. So I don't really have that much time to address you because of the fact I'm trying to teach you right now the whole fundamentals. And once you get to the fundamentals and you learn that fairly well, then you can really do some really good things for your patients or yourself. You don't have to be the patient. You can be for yourself and your family. And that's the idea, okay? So you got a simple tool like the Quantum Infinity, and you want to graduate more advanced. Some of you have done it. You go to the Pro, and then the Pro is really intensive because I run you through. You get all the different types of programs you can access, you know. And the problem is you're limited if you don't have enough categories that you can go into. You only have a handful. And don't be fooled because you think that's it. No, it's not. It's continuous. Even though I produced about 208 different programs, I'm still trying to finish up another 25. And I just got to get the time to do it. Okay, I got the research all done, but I got to do it. Okay, so anyhow, we're open for questions. If you have any questions, please type it in. We have a few minutes left, and be glad to answer any questions that you may have.
Okay, there is a question here, and it's how do we use the Infinity to test?
Okay, first of all, you got to really understand the protocol, the step by step, how do you do the protocol, the Infinity. Then what you do is, once you get all the parts and tools to it, with the pro users, I made charts for them for when they did the, what we call the auras, and then I made charts for them how to do the sound synchronization, uh, so it makes it easy for them, and the selection of the words. Okay, that's the first part when you go through that. Then the next one, you go right into the Da Vinci, and so it's very simple. You press your scan button, and it scans away, and then you look at that, and you're going to drop everything into the multi-level, the three highlighted ones. Look at the numbers, and then you go into further, and it tells you all these different indicators. And from the indicators, if you have all the categories I have, then you can go to the squiggly icon, go to those, and you start selecting one by one in those whole categories, have a group of information, and you keep working that and working that. One of the persons that came from Mexico, he said that he couldn't get past 50. All the times he scanned himself, couldn't get past 50. Well, we got him over here about 89. We ran him right through in 2 hours. We ran him through, and he got 89. So there's no reason why you can't bring this up from, say, the numbers that you have when you first have a Da Vinci, and you work your numbers up percentage-wise, like alignment, harmony, and that stuff. You should be able to bring it all up to 85 within an hour and a half. And we have so many things in the multi-level prescription area. Okay, so yeah, that's sort of general, but I made charts now, so you can follow step 1, step 2, step 3, and you flow. And we said, think out of the box. When you think out of the box, you say, oh, I got all these choices I can do. Now, the choices are that you thought before that you had the choices, but you didn't have the category. So how can you go ahead and scan them with that? You don't have anything. Now, would you have to scan in the Pro? You scan that, you keep scanning them, and pretty soon you're going to be surprised because it was form a pattern of what these things are. And then you start to break it down into more defined role, and it says, I'm going to concentrate on these areas here. I'm going to balance off the rest that maybe are not the major causes, but contributing causes to your problem. And then you keep doing that, and pretty soon you're reducing the stressors that bombard the immune system, which creates, if it does that, the autoimmune disorders like high blood pressure, early dementia, diabetes too, those things. That's how you do it. So you got to go through a protocol. You just kind of jump here, and you're trying to say, okay, this is what it is. And you have to follow a protocol. It makes it easy. After you do a few of them, you get, oh, this is terrific. So we made some charts like that for pro users, and they like it. Okay. I hope I answered that in a long way. Okay. Any questions? Any other questions?
Okay. Can someone choose to take 1 or 2 classes, or must they all be taken?
Well, it's your choice. We like to have you get foundation, and you can't take 1 or 2 classes because their other classes are dependent on foundations from another class. And the reason I do this, I'm trying to give you from the priority, and the first one was 7 CEs. It gives you the foundation. It gives you a system. Right now, for over 30 years, I've been trying to figure out what is a system that can bridge the philosophy or the disciplines of the Western world, traditional, to the Eastern world, Oriental, to the European. What can a system be able to bridge all those implement categories according to the body section of the body? Well, we did that, and that was the 7CE. And the next one was the brain. Now you're going to access the brain, all the parts of the brain, everything you think about, structures, blood vessels, nerves. We're trying to do that. So you understand the brain is so, so important. Now you get to the next level. That's 2 levels, okay, 2 different webinars. And if you missed the first webinar, you can always go back and get the other webinars or recording. You just dial into us, and we just send you all the recorded diagram. But not only that, you get all the charts that I made over the years. Nobody has the charts except you. And those charts are valuable once you get to learn how to use those. Those are real quick references that you can go back and say, oh, now I understand what's going on. Here's a chart that shows this. See, so you getting all this backup material summarized. You don't have to look into textbooks after textbooks. I did that for you. And then, so you don't have to take them all. And so now you select, so why do I want to treat pain? Well, most people get paid. I figure you want to. That's why we took the third webinar. And the fourth one is cardiovascular. Everybody got problem with cardiovascular as you get older. They think, right? But maybe not. If you can go ahead and do the precursors to help you alleviate some of the problems that may arise from the heart problems. So you got to figure out where you're at. And so I'm making everything in order as priorities. So the next one is going to be cardiovascular, the next one is going to be diabetes 2, the next one is going to be T toxicity, the next one will be digestion. In between, we'll have special seminars that teach you something just a little bit different that you might have heard, but you don't know anything about. There's nobody teaching it. I'll teach you that. So that's a bridge. So this is the kind of courses we take. I'm sorry, I apologize. I give you too much information, but I'm trying to summarize it for you in 4 sessions of hour and a half versus 3-4 semesters of school. So that's it. So you got to study. You don't study, you don't going to learn. And then we teach you the protocol through an actual workshop. Okay. I hope I answered that question.
Okay. So how long did it take to get him to 89?
Hour and a half, because it took me, because depending on what you're looking at. So this person has some kind of problem that I don't want to mention that too much because it's private, but anything, he had problems with the eye. So then I said, okay, you got problems with the eye. I'm looking at, okay, diabetes, then I'm looking at blood flow, then I'm looking at probably the kidneys, and I'm looking at the liver, and I look at all these things that has a joint. So I said, I don't know if it is, okay. So I run through the computer, and I said, oh, yeah, it's all what I thought, some of them are coming out. Then I'm going a little further with these categories I made, and it goes in there, and it goes deeper into the problem. It's, oh, now these things are coming out. Let's see what kind of remedies could match that. Remedies can be from 10, 12 different companies. I find out which one it is, the best one, and then you test that, and you go, oh, okay, see, now you start gathering data for this, and then you say, are you going to take it? No, more, but balance it out, and maybe that's frequency from the supplement itself. I just needed to do this and balance it out, and another one pops up because you clear one layer out of the problem, and the next layer comes up. It works in layers, and then you have to deal with that. So that's basically took me some cases, I can do them in 20 minutes because I know what I'm doing. Most people are going to take about half an hour, 45 minutes maybe, depending how complex the case is. And then you're going to take at least an hour and a half to run them through the balancing, because I go every 16 minutes. I don't go every 3 minutes. I tried it 3 minutes, I tried it 6 minutes, I tried continuous, 16 minutes. Why? After 16 minutes, I can see if the numbers come up. I look at how much the numbers go up in terms of the percentages. And then I have to decide whether I got to add some more things, and maybe I'm missing something. With the other guy I went through, the other patient, the second round went up to only 3%. Like, whoa, what happened? How come? And all of a sudden, I read it again for 16 minutes. It jumped 25 points. Like, whoa, okay, 25 points, right? So he hit a block someplace there, but he ran through the block of the. So I'm just really trying to give you my experience, what's happening. Okay.
Okay, so we have a correction on the last statement, and what she says is, can someone take class 2 and 4 of the cardio webinar itself?
If you do, you're shortchanging yourself. I tell you the reason why. You might know the structure, or you might miss the structure, and then we allude to the first part, and you say, I don't know what you're talking about, because I didn't understand what structure we're talking about, what function we're talking about, what part of the heart valve, capillaries, whatever, and you're trying to figure out, you're going to spend more time trying to figure things out. So if you take it, it's all one price. What do you want to break it up for? If you can't take it in because you were doing something, and some of my patients they live in France and England and Germany. They can't because of the time difference, so they take the recordings. And then they come back and tell me, okay, did this, and I say, okay, you do this, you do that. See, so sometimes you're busy, something happens. That's why we have a recording, and the recordings go to you. Well, as soon as we finish the recording, 2 days later or 3 days, boom, you got it right in your hands. We don't have to wait till all the webinars are finished. We just send it right to you. And we send you before you start for your studies, just to look it over so you can follow me, the whole script without narration, of course. because then I do the narration, you get the recordings. Okay, go ahead.
Okay. Are there any last questions before we sign off for the evening? Anybody have a burning question that they want answered before we're finished here this evening? I'll give you a second or two here. For those of you that are new, you type your question in and then you hit return on your keyboard and it will shoot it over so that we can see it.
Yeah.
Okay.
If you have any questions, you can shoot me a email and I'll be trying
Right.
to answer you.
Okay. All right. Well, thank you, Dr. Char. This was most informative, and all of your classes are awesome.